Hello, my name is Tara Ronslave, and I am a graduate student certified in human sexuality working on a master's in the field, and I think we should talk about contraception. Again, this is part 2 to my video on contraception as a part of my Sex Ed 101 series on things that you may or may not have learned in school, but that you probably should have. In part 2, we're going to be looking at our hormonal contraceptive options. So sponges, diaphragms, cervical caps, internal condoms, those sorts of things are not super popular options for birth control these days. If you go into a doctor's office and are looking for birth control, and oftentimes if you go into a doctor's office for a number of other reasons, they will offer you a hormonal birth control option. Hormonal birth control uses the hormones estrogen and progestin, which is a synthetic version of the hormone progesterone. Now, estrogen and progesterone probably sound familiar if you watched my anatomy video, as these are hormones that our body creates naturally as a means of regulating our menstrual and ovulation cycles. The progestin prevents follicular development, which means that it basically tricks your body into thinking you have just ovulated and therefore do not need to drop an egg. The progestin also thickens the cervical mucus, making it more difficult for sperm to enter the uterus or anywhere where a sperm can meet an egg and fertilization can occur. Although never say never, even with birth control. A lot of birth control options also include estrogen, which not only helps to prevent ovulation, but also prevents the buildup of the endometrium. Now, the endometrium is that lining on the inside of the uterus where a fertilized egg would implant in order to grow a baby. So, options that have estrogen in them often either reduce or lighten a period or prevent you from having a period altogether. That estrogen is also a massive factor in a lot of the side effects that often occur with hormonal birth control, particularly in the first 3 to 6 months being on a new hormonal birth control option. There are a lot of associated side effects, both positive and negative, and some people get a lot of them, some people don't have any of them, and some it just depends on which brand of birth control they're using. Every body is different, which is why it's so important to listen to your own body when you are trying a new birth control option and to discuss that with your doctor so they can find you the best option for you. So on the less pleasant side of potential side effects with hormonal birth control, we're going to start to sound a little bit like that end of a drug ad where they list all the terrible things that could happen to you. And it goes a little like this. Hormonal birth control can come with headaches, nausea, sore breast, period changes, spotting, dry skin, melasma, which is a type of skin hyperpigmentation, weight gain, bloating, mood swings, increased chance of yeast infections, vitamin level depletion, especially B12, inflammation, decreased sex drive, and there's research showing that Crohn's disease is actually 3 times more likely in those who take hormonal birth control. Also, if you're over the age of 35 and a smoker, hormonal birth control is generally not recommended as it does increase your risk of blood clots. I'm not trying to scare you off of birth control though. Hormonal birth control that includes estrogen can also come with a ton of benefits beyond, preventing pregnancy, the main benefit. Hormonal birth control is shown to decrease your risk of ovarian, endometrial, and colorectal cancer, can make your periods more regular, it can make them lighter, it can even make them non-existent. It's used to treat hormonal acne, manage PMS and PMDD symptoms. It is used to manage endometriosis pain. It reduces your chance of anemia and reduces your risk of ovarian cysts. Birth control also gives you a degree of control over when you bleed, which I will touch more on later. But because every body is so different, once again, it's really important to discuss with your doctor which option is going to be best for you. And sometimes it takes some trial and error to figure out what that best option is. So, disclaimer over, onto the stats. Hormonal birth control comes in a ton of different delivery methods, but the first option that a lot of people start with is the pill. As I mentioned earlier, the pill comes in both a combination form that includes both progestin and estrogen, and a progestin-only form, or the mini pill. Different brands have different dosages, and even the non-active ingredients can have an impact if you're especially sensitive to medication, which is why there's often trial and error involved. All hormonal forms of birth control do require a prescription, which means they require a doctor consult, but especially for birth control pills, there are a ton of telehealth options like GoodRx, Nurx, Favor, and the Planned Parenthood website and app, where you can have that consultation online and never have to go into an office, and then they will mail you your birth control straight to your door. Insurance, as it is now in the United States, although everything's all a bit up in the air, is required to cover birth control options, at least some of them, 100%. So if you have insurance, you will most likely be able to find an option that is completely covered. If you don't have insurance, Planned Parenthood or some of those other telehealth services offer reduced cost birth control that you can access online. The pill is 99% effective with typical use and 91% effective with typical use. Now, that typical use discrepancy is usually related to not taking your pill every day or not taking them at the same time every day. The progestin-only pill needs to be taken at the same time every day within about a 3-hour window, and every pill in the pack needs to be taken. The combination pill has a little more wiggle room when it comes to taking the pill at exactly the same time, but taking it at the same time every day can increase the likelihood that you will remember to take your pill. The combination pill includes placebo pills at the end of the pack. These placebo pills are often called sugar pills, and they basically don't have any medication in them, but they are included in the pack to make it easier to stay in the habit of taking a pill every day. Placebo pills were added to birth control packs in order to allay the sort of fear or unease that comes with not having a regular cycle. However, the bleeding that you have on those placebo days is not actually a true period. It's what's called withdrawal bleeding. So basically, it's related to that drop in hormones that comes with not taking your pill that causes a faux period. It mimics a period, but it isn't medically necessary. A lot of people think that the placebo pills are there in order to give your body a break from the hormones, but this isn't necessary. There's no evidence that starting a new pack the next day and skipping your placebo pills has any negative effects on your body. In fact, the only negative effects that may come around are more to do with insurance and finances, as that does mean you will have a higher quantity needed, and some insurances will only cover a specific quantity of packs of pills each year. But being able to skip placebo pills is what I was referencing when I said that birth control can give you a degree of control over when you bleed. For example, when I was on hormonal birth control options, I often skipped the placebo pills if they happened to come up on a weekend that I had plans and didn't feel like dealing with potentially bleeding. There are some things that will lower the effectiveness of a birth control pill beyond not taking them correctly. And these are things like having diarrhea or vomiting for over 48 hours, and then also combining birth control pills with certain medications. For example, the antibiotic rifampin, specifically that one, most regular antibiotics that you receive will not have an impact on your birth control. Griseofulvin, I'm probably butchering that. That is a specific antifungal that tends to counteract birth control pills. Some anti-seizure medications, including Topamax, which is often prescribed for migraines, and St. John's wort, which is an herbal supplement that is often used to treat skin, mood, PMS issues, and you need to be careful with because it actually, I believe, counteracts quite a few medications. So make sure your doctor knows every medication you take, whether that is prescription, over-the-counter, or herbal supplements, that sort of thing, when they are prescribing you a birth control option, so that they know exactly how to give you the most effective birth control. There are other methods of delivery when it comes to the hormones used in hormonal birth control, however. There is the patch, the ring, the shot, the implant, the IUD. These all use the same hormones, whether a combination of progestin and estrogen or just progestin, but they are absorbed into your body in a different way. The patch and the ring both use a combination of progestin and estrogen, so those are options that may come with those estrogen-related side effects. But then we also have the implant, the IUD, and the depot shot, which are all progestin-only options. There's also a non-hormonal IUD, which we will talk about later. The patch is just what it sounds like. It is a sticker, essentially, that you put on your body, whether that's your arm, your belly, your back, or your butt, for a week at a time. After a week, you replace that patch with a new one, and then the next week for 3 weeks in a row, and then you generally take a week off after that. You'll continue to be protected for that week as long as you remember to apply your next patch exactly 1 week after you removed your last one. Patches can be a good option for those who don't like to take a medication every day or struggle with remembering to do that. Although, personally, I find things more difficult to remember on a weekly basis than on like a day-to-day, as it's not a part of my routine. But there are apps you can use to remind you, whether that's just throwing it in your calendar, or specific birth control apps to remind you to change your patch. If you're someone who spends a lot of time in water, whether you're a swimmer or a water polo player or a mermaid, I don't know, the patch is probably not the best option for you, as spending a lot of time in water can cause the patch to start to peel, and obviously that's going to affect the effectiveness of it. The patch is also not recommended for those who have a BMI of 30 or higher, which I can do a whole video on how the BMI system is not based in health or medicine or science, and is actually incredibly detrimental to the healthcare system and fails women, people of color, the elderly, etc. I can do a whole other video on that. I have a lot of thoughts on the BMI system, but in this case, it is related to the dosing of the hormones in the patch. A BMI of 30 is not very high, by the way. For a person who is 5'4", which is the average height for people who identify as women in the United States, that's only about 175 pounds, which is not a lot of weight. It's important to also be aware when disposing of the patch that you need to fold it in half, maybe wrap it in some tissue paper, as there could be some residual hormones on that patch, and you don't want kids or animals to get into that and touch it. And you also don't want those hormones leaching into your water or the soil. So whatever you can do to prevent that. There are two major brands of the birth control ring in the United States. Those are the NuvaRing and the Annovera ring. They are both inserted very similarly. You pinch the sides, put it inside yourself, push it up as far as you can, and it sorts itself out. Like a tampon, if it's in correctly, you won't feel it and you can just go about your day-to-day activities. However, if those day-to-day activities involve penetrative sex, it might get a little uncomfortable in those situations, and you can remove it for short periods of time in instances like that. However, the amount of time you can have it out of your body is dependent on the brand that you are using. The NuvaRing, for example, will lose effectiveness if it is out of your body for more than 48 hours in a row. The NuvaRing, once inserted, is used for about 5 weeks, about a month. It is then taken out, disposed of, preferably by wrapping in the foil wrapper of the new one, for the same reasons as the patch, leaching into the soil and water systems, and then a new one will be inserted. Because it is continuous use, meaning you insert the next one immediately after you remove the last one, the NuvaRing, for most people, will allow them to skip periods entirely. And if your insurance sends you a bunch at one time, which they might, sometimes they send you 6 months or a whole year at once, you can take the ones for later and store them in your fridge and keep them nice and fresh. The Anavera ring is worn for 21 days, removed for 7 days, and then reinserted for 21 days, and so on and so forth. Unlike the Nuva ring, the Anavera is not disposed of each cycle. It is worn for an entire year, or about 13 cycles. For that 7-day period in between each of your 21-day cycles where you're not wearing the Anavera ring, you will remove it, wash it with some soap and water, wipe it off with a paper towel, and then it comes with a cute little case that you can store it in until the next week when you need to reinsert it. The Anavera cannot be removed for more than 2 hours within each of those 21-day cycles. That's 2 hours in a row or 2 hours total. So even if you remove it in small increments, it cannot be over 2 hours total. So say, for example, you're one of those people who finds penetrative sex with the ring in uncomfortable. If you take it out for 30 minutes at a time, you can only do that 4 times within that 21-day cycle before you start to lose effectiveness and increase your risk of an unplanned for pregnancy. The Anavera can also not be combined with any oil-based or silicone-based products. That means oil-based lubes, coconut oils, any sort of medication that comes in a cream or gel form, any sort of lubricating suppositories, anything oil-based is going to degrade the material of the Anavera ring. So if you're looking for a lubricant, it's important to stick to a water-based one if you are using the Anavera ring. Water-based lubricants are also compatible with silicone sex toys, so it's really just a good general all-around option if you're looking for a lube. The pill, the patch, the ring, these are all options that require you to keep track of how long they are in or on or out of your body. So if you're looking for an option that takes user error out of the mix and you don't mind losing the benefits of estrogen, or you're trying to avoid the side effects of estrogen, then a physician-assisted option might be better for you, like the implant, the IUD, and the shot. The Depo-Provera shot, often just called the Depo shot because it's a little easier to say, is an injection given every 3 months in the physician's office in either your bum or your upper arm, or potentially both. Sometimes they switch between the 2 locations for each shot. Some doctors do allow you to give yourself the shots at home. In that case, you are probably going to give them in your belly or your thigh because they are intramuscular shots. So you're basically just looking for areas that you can easily reach where there are big chunks of muscle. You have a little bit of wiggle room when it comes to scheduling your shots. You can get your next one as early as 10 weeks after your last and as late as 15 weeks after your last. However, if you wait more than 15 weeks, you're going to want to use a backup form of birth control, like a condom, for at least a week, just in case. The Depo shot is known to make periods lighter, but spotting is pretty common during the first 3 to 6 months. You may have also heard that the Depo shot is going to make you gain weight. Is this true? Well, maybe. So some studies show that the amount of weight gain between the Depo shot versus any other birth control form is negligible, while others show that the Depo shot is more likely to make you gain fat. This is related to the glucocorticoid effect, which is often seen in people who take medicines like prednisone or other steroids like that. Glucocorticoids mimic cortisol, which is a stress hormone, and stress hormones cause your body to retain fat cells. So does this mean you shouldn't go on birth control because you might gain some weight? No. You know what else is incredibly stressful and often causes people to gain weight? Unexpected pregnancies. Every birth control option, hormonal or not, has pros and cons. It's important to weigh those pros and cons for your life and your priorities. The Depo shot, though, does have one other con you might want to add to the list. Unlike most forms of birth control, if you go off of the Depo shot in order to conceive, then it might take you a little longer. The depot shot has been known to delay periods and therefore your ability to get pregnant for up to 10 months after your last shot wears off, which means 13 months from when you had your last shot. This is not something that will be harmful to your body. It is just something to keep in mind because the process of trying to conceive can be very stressful. So it's good to know why it might be difficult to conceive. But if you don't like the idea of the depot shot because you are afraid of needles, then the next option probably also isn't for you. The implant, the Nexplanon, is a matchstick-sized rod that is inserted into your inner arm, right around here, using a hollow needle. Usually a numbing medication is injected into your arm prior to the insertion of the Nexplanon device, so we've got 2 needles, one kind of big. However, you only have to do it once, and you're protected for up to 5 years. After that 5 years, or if you want to remove your implant earlier than that 5 years, they will give you another numbing shot, make a tiny incision, pull that Nexplanon out with some tweezers, and then if you want another one at that time, they will insert it in the same process. After 1 week, it is fully effective, and you don't have to think about it at all for 5 years. However, because it's out of your hands, it's also out of your control. So, say you're taking a birth control pill, you have kind of a funky reaction to the hormones, you don't like being on birth control anymore, you can stop taking them before you even make an appointment with your doctor. With the implant, you are going to have to go in and have a doctor remove the implant for you. Now, it's progestin only, right? So most people don't have weird reactions, and if you've been on the mini pill before, then you will know exactly how your body's going to react to progestin. I'm a bit of a control freak, so it kind of weirds me out, but it's a great option for a lot of people. The implant also typically stops your period, but you may have some spotting for a while. A note, if you are prescribed rifampin, which I touched on earlier, that is an antibiotic specifically used to treat like tuberculosis and certain forms of meningitis. It is going to reduce the effectiveness of your implants. So it's important to let your doctor know that you have an implant if they are prescribing rifampin. You may think, obviously my doctor knows I have an implant. The doctor put it in for me. Probably not. Actually, most primary care doctors do not insert Nexplanon devices, and they will refer you out to a gynecologist to do that. And a gynecologist is who you're going to want to talk to about the next option as well. That's the IUD. IUD is short for intrauterine device, and it is a little T-shaped plastic device that sits inside your uterus and releases progestin. It has little strings that hang out of your cervix and into the top of your vaginal canal, which you are able to reach up and feel and make sure it is still in place. It's also how they will remove your IUD when that time comes. There are 4 major brands of hormonal IUDs. Those are the Skyla, the Mirena, the Kyleena, and the Liletta. So the Skyla lasts for 3 years, the Kyleena for 5, and the Mirena and the Liletta are good for 7 whole years. The IUD is the most effective form of birth control. Over 99%. Not 100. Nothing is ever 100%. However, there's no user error there. It's inserted and you don't have to think about it. However, they are also one of the most invasive forms of birth control and often require a pelvic exam and an STI test prior to insertion. While most insurances cover the IUD, it's important to take a look at your insurance coverage and factor in that it will also probably involve multiple appointments and some lab testing. If your STI screening comes back and shows that you're positive for certain infections, they will often tell you to go off and treat those first before you come back and have your IUD inserted. You may also have some difficulties getting an IUD if you have untreated cervical cancer or uterine cancer, if you have experienced a pelvic infection post-childbirth, if you have had an abortion in the past 3 months, or if you have certain pelvic inflammatory conditions. Some of these, they may say you should just use a different option. Some of these you may just have to wait on a little bit and then come back for an IUD. later. If you are all clear to get an IUD though, this is how that process is going to go. So they will use a speculum, the same tool they use to open up your vaginal canal during a pap smear in order to get a better look inside. They will then use a cervical clamp to grab hold of your cervix in order to stabilize it. They will often then use a sound, which is a metal rod, in order to measure the depth and the angles of your cervix and your uterus. And then they will use a special device to insert the IUD through your cervix and up into your uterus. Those T-shaped wings at the top of the IUD actually are folded down during the insertion process, and then they pop open once they're inside your uterus in order to anchor it in place. Your gynecologist will then go in and trim those strings hanging out the bottom to make sure they are not long and uncomfortable, but are long enough that you can still reach up and feel them to make sure they're still in place. If all goes well, the whole procedure shouldn't take more than 15-20 minutes. However, those might not be a very comfortable 15 to 20 minutes. In the United States, it is very uncommon for anyone to receive any sort of pain management when it comes to gynecological procedures. People's pain tolerances vary immensely. Some people describe insertion as just feeling like a little pinch, while others will vomit or pass out from the pain. It's recommended, regardless of your pain tolerance, to take the rest of the day off because cramping and back pain are very common in the hours after an IUD insertion. You can take some ibuprofen prior to the procedure in order to manage the pain of the procedure, and then afterwards to manage the pain of the cramping that comes with it. Some say that there is some cramping that lasts for a while after your IUD is inserted, while others say that they cramped for maybe a couple hours and then they felt fine. All bodies are different. All pain tolerances are different. All responses, reactions are different. The first 3 months after insertion and during your period are when your IUD is most likely to slip out of place. So it's important to regularly check on those strings, make sure it is still sitting where it needs to be sitting, that those strings have not changed in length significantly or you can't find them. It's also a good idea to avoid the sort of menstrual cups that use suction as part of their process, because that suction effect can sometimes suction your IUD right out of its spot. Hormonal IUDs usually don't stop your period, but they often lighten and lessen your period as well as your period pain, which is why they're often used as a treatment for endometriosis and PCOS. There is one other kind of IUD though. This one doesn't use hormones to prevent pregnancy, it uses copper. So it looks basically the same, but it has a tiny copper wire wrapped around the outside of the IUD. What this copper does is, once it is inside your body, those copper ions create a toxic environment for sperm, basically making them run the other direction as soon as they come into contact with it. The Copper IUD, the Paragard is the name of it, is completely hormone free. So it's not going to cause any of those side effects that come with hormones. So if you already have some hormonal issues, it's not going to impact those. That also means it's not going to impact your menstrual cycle in a positive way either. In fact, a lot of people say that the Paragard actually makes their periods longer, heavier, or more painful in at least the first 6 months, because copper, that toxic environment it's creating for the sperm, can also have an inflammatory effect on the body. And obviously, if you have a copper allergy, intolerance, or a copper metabolism disorder like Wilson's disease, then the copper IUD is not the best option for you. But if your primary goal with birth control is to control birth, to prevent pregnancy, then there really isn't a better option than the Copper IUD, the Paragard. It is 12 years of protection that you don't have to think about. Insurance can be used to cover the cost of your Copper IUD. However, if you don't have insurance, but you are over 18 and your income is at or under 200% of the current poverty line, then there is a Paragard patient assistance program where you can apply and qualify for them to cover the cost of the Paragard for you. one more note about the Copper IUD. The Copper IUD can actually be used as an emergency contraceptive option, and it's often a better option than something like Plan B or Ella. However, I have been talking for a very long time, and your brain is probably a little fried from all of that technical information I just threw at you. So I will be covering emergency contraceptives as well as more permanent options in part 3. Thank you so much for watching. My throat is actually kind of sore from talking so much, so I should wrap this up quickly. You know the deal. Push the buttons, do the things. Check out the resources I have linked below. I will link to the Telehealth Services, and I don't know what else. You know the deal. Push buttons, leave comments, talk to me. Follow my Instagram, follow my, subscribe to me here. Bye.